Hello, this is Dr. Drew Taft with Foot and Ankle Associates of Southern New Hampshire, and this is another fast foot fact. We are continuing our discussion on ingrown toenails. Last time we discussed the definition, causes, and symptoms. Now I'm going to quickly just go over some treatment options. So again, once we've established that you've gotten an ingrown toenail, then there are certainly some things that you can start to do to treat it. Some of this is stuff that you can begin to do at home. If you've got some early discomfort, just some soreness around the nail plate, but it's not red, it's not swollen, it's not inflamed, then sometimes you can just start doing things like simple soaks, warm water soaks with or without Epsom salts, 5 or 7 minutes. You can start using hydrating agents or moisturizing creams, Vaseline, and massaging it around the nail plate to just try to soften the skin around the nail to make it more comfortable. Obviously making sure that your shoe gear is fitting appropriately, not wearing things that are too tight or too stiff or too narrow to help keep the toenail from constantly being irritated and impinged. But assuming that doesn't work and your symptoms persist or they worsen, then most of the time that ends up going on to something that we typically have to treat in the office. So there is a procedure in the office where we can actually remove a section of the toenail. Basically, this is just a small section of the nail and only the piece of the area or the side of the nail that is causing the problem. So this doesn't mean that an entire nail has to be removed, but it typically means that a several millimeter slice of nail down either side of the nail is taken out. Typically, we combine that with a little chemical that we use to cauterize the root of that piece of nail that we take out so that it never grows back, okay? Because most of the time, if you remove just the offending border of the nail, that will treat the symptoms temporarily, but within 6 or 7 months, people are usually back in the office with the same problem. So we end up doing the chemical at that point. So usually I recommend the chemical, fix it, get it over and done with, as a good way to have a good long-term predictable outcome. So stay tuned. We'll wrap things up with another conversation, mostly about prevention and some complications that come along with this. I appreciate your time. Thanks again.